We just wrapped up with having Dr. Werner on the show here, and we dived into so many topics in this episode, from mitochondrial health, low dose naltrexone, the immune system. And one topic that I think that really struck me that I think is going to be really interesting and that you guys are going to take a lot out of today is the topic of the carnivore diet.
Who would have thought that the carnivore diet may be a way to address the toxic world we live in? This has not come up on the pod before, and wow, I was stunned by what she had to say about the carnivore diet and the outcomes and her experience with it in terms
And
of
normally
toxins.
when we think of detoxing, we think of green juices and fasting. So it was just really interesting to hear her completely opposite approach to that.
All right, so let's get to it. Hello and welcome to another episode of the Vibrant Wellness Podcast. I'm your co-host, Dr. Emmy Brown, and I'm joined by my wonderfully clever co-host, Melissa Gentile. Today, our guest is Dr. Stefanie Werner, a licensed naturopathic physician and owner at Synergy Restorative Medicine in Mesa, Arizona. Dr. Werner is not just a healthcare provider. She's a trailblazer in treating some of the most challenging medical conditions, including neurodegenerative diseases, autoimmune disorders, and chronic infections, which she explains have exploded as societies increase their dependency on industrialization, immediate gratification, and synthetic substances deemed as medicine or food. Dr. Werner's approach is not just about treating symptoms, it's all about empowering her patients to embrace their body's natural healing abilities. With her extensive training in peptides, hormones, mitochondrial function, and immune system dysfunction, she's adept at navigating the complexities of our modern toxin-filled world. But that's not all. Dr. Werner is also an accomplished athlete, having completed multiple half marathons and full Ironman triathlons, showcasing her belief in the power of physical endurance and mental strength. So buckle up for an enlightening and I'm sure very inspiring conversation with Dr. Stefanie Werner. How you doing, Dr. Werner? We're so glad to have you.
Awesome. Thank you so much for that intro. I always forget sometimes that I've done those things in my past because it was so long ago. But at any age, I always tell people it doesn't matter. Let's fix your body so it can heal, so you can get back to your activities.
That's an awesome perspective. And honestly, Dr. Werner, I just want to dive right into your expertise. And usually in this field, most of the practitioners that we're interviewing on the podcast have a really unique story and perspective on how they got from conventional medicine to functional medicine. Some people grew up on functional medicine, et cetera.
Right.
But what I want to ask you right off the bat is, did you have a breaking point with conventional medicine where you were just like, this is not it? I got to pivot.
Right.
If you did, let's expand on that.
That is always such a loaded question because you're right, especially within the field of naturopathic medicine. Most of the people who get into this medicine has some sort of story. And one thing that mine is a little unique in that I was in the process of becoming a nurse. My mother was a nurse. She was an ICU nurse in Yonkers, New York for a long time. And I always knew I wanted to go into healthcare. But really, when I first met my chiropractor, I was actually going to be a chiropractor before a naturopathic doctor. I met the chiropractor, and before we even sat down and went through my history, he looked at my x-rays. He said, "You grew up and you had lots of earaches, didn't you?" And I'm like, "Wait, what? How'd you know that?" Sure enough, I mean, I had tubes in my ears from the age of 12 to 18. I had surgery after surgery, taking out my tonsils, adenoids, earache, all these medications. But that's what we knew. My mom was a nurse and that's just how you grew up. And I developed allergies. I developed a lot of problems. And when I was 18, my ear, nose, and throat specialist told me, "Hey, you're an adult. You're supposed to grow out these earaches." And we stopped doing tubes and all the earaches came back. And I was miserable. And at 20 years old, you can't go underwater. Well, through my teenage years, you can't go underwater when you have tubes in your ears. So I missed out on opportunities, for swimming and things that I love doing. And when I met my chiropractor at 21 and he said that, I said, yeah, that's exactly how I grew up. And from starting of his adjusting my upper cervical, that's when all the earaches completely stopped and my headache stopped. And a lot of the things that I figured I was just going to have to live the rest of my life with stopped. And that's when he introduced me to the idea of that the body has been designed to heal, to be self-regulating and self-healing. Like, why is there such a disconnect? So I did go into chiropractic school, finished the first year at Life University. And that's when I had a unplanned event He is now 16. But I stopped the doctor program to focus on raising my son and, started working on a holistic master's program. And it was during that time when I stepped away from the chiropractic program, I met a neurologist. And that neurologist told me, you need to be a naturopathic physician. You get how the body heals. And all I was doing at that point was working on the nutrition side of educating his patients. So really, it was a neurologist that introduced me to naturopathic medicine. And that's what brought me out to Arizona to complete school. And it was a journey like no other, but really it just made sense, that we know how to heal. Where's the disconnect?
And what about environmental medicine, Dr. Werner? Was there a specific patient case or experience of your own that really inspired you to focus on environmental medicine?
So I started when I was in chiropractic school. I actually started learning about the environment and what we're doing and how we're harming children. And that set me off into the whole world of heavy metals. I actually personally had a lot of heavy metal testing and going through chelation. And so when I entered into naturopathic school, I already had a passion for home birthing, parents learning about what they need to help guide their children, how to feed their children, the birth process, on how the birth process can make or break your child's health in the future. And of course, the series of vaccinations that come with that. And that literally was what I was passionate about. I was going to become a naturopathic midwife. And then I learned that 9 to 5 was much nicer than
I hear
2:00 in the morning, sitting on a birth for 12 hours on call. I still am a huge supporter in teaching women and couples on the birth process, because it's not this horrible medical surgical thing that we make it out to be. It's a beautiful process. So that's a whole nother story. But really, it was going into school and understanding that there has to be a better way. Healthcare really starts, before you're even born, what the mom, and we'll get into that with the toxins, but how a child is grown and birthed and fed really is the future of healthcare. If we want to change it, we need to teach parents how to be healthy before they even get pregnant. And that's where a lot of these environmental toxins come in. And my very first patient outside of clinic and outside of med school was a chronic neurodegenerative condition. He didn't know how to read and write anymore. He was forgetting who his wife was. He looked like your typical Parkinson patients, just the shuffling. And he was losing a lot of his ability to maintain his own hygiene. And the only thing, the wife of this patient came in and said, I have one lab from years prior that showed he had babesia. And the people who are in the chronic Lyme disease world, they hear that term and they're like, oh my gosh, what'd you do for him? Because that is one of the hardest things to treat. And he had been misdiagnosed. And so what I said is, well, I know how to treat the body, so let's give the body what it needs. And that's also when I met my mentor. And he helped guide me on how to treat this guy. And within 6 months, he was reading again, writing again, having conversation, recognizing his wife, being able to shave himself, go to the bathroom. Like, you don't have that type of experience and then not say, all right, well, now let's bring in the immune dysfunction of everything else in there. So that's what set me off to really focus on neurodegenerative conditions and the immune system. My mentor, and this was 8 years ago now, my mentor told me that the future of medicine is environmental medicine, which causes immune dysfunction and neurodegenerative conditions. So I'm like, okay, I'll go ahead. I'll just be ahead of the curve at this point. So that's what kind of got me to where I'm at now. And I have seen it over and over again. You treat the body, you heal the body heals itself, move on to the next patient. It takes time, but it's doable.
And I have to ask there, Dr. Werner, you saw the babesia and you mentioned treating and supporting the immune system.
Right.
And that's foundational. Were you also using antimicrobials to go after the babesia also?
So I started with those patients. I'll use some of the antimicrobials. I'll use antibiotics now, but I did a lot of nutrient, amino acid support, immune system balancing. It's before I even knew about naltrexone. There's a lot of things. I just did the basic foundation. That's it. and he started getting better, gaining weight, and so it was just cool. And now it's like I'm equipped even more now to make it speed it up and make it go faster if you can, in that healing process.
Actually,
Right.
Dr. Warner, I actually wrote down that I did want to ask you about naltrexone because I know LBN is kind of a hot topic right now, and I know some
Right.
providers use it, some providers don't. How do you use it in your practice? What are your thoughts on it, and what conditions do you use it in?
I absolutely love naltrexone. I have actually spoken at 2 of their conferences. The first one was using it with a chronic immune issues. It was a condition called Mallorit's disease, which is a chronic infection that gets into the central nervous system and just wreaks havoc. So I used it with that patient. And then I did use it for kind of like emergency med too, which is kind of funny. Patient comes in with trigeminal neuralgia was one of them. And the other one was temporal arteritis, which we know can be emergency type events. And naltrexone was beautiful in being able to bring down the inflammation in that patient and get them to a place where, well, we didn't have to use the prednisone because I'll use prednisone if I have to and it's warranted. But learning how to hear what the patients and see what the patients, how they respond, that's an art. And naltrexone falls into that category where you really have to listen to the patient, check in with them, explain very, very, very well on what they expect. This way the patient knows, okay, well, I'm expecting this, so it's not an emergency. For example, if they're having insomnia for a week, those little things, and taking that time to educate the person on the why, the how, and what to expect. That's where it becomes a beautiful relationship on how to use something as powerful as naltrexone. It doesn't work for everyone, but for the majority of my patients, it does.
And is that something that's long term? Is it short term? And can you describe what it actually is doing in the body?
Sure. So naltrexone in higher doses has been used historically to help with people who have different addictions. So it's more known for that, but that's like 50 milligrams. That's a higher dose. But where we're using something that's lower, let's say 1 milligram, it has a unique quality to be able to go in and help with balancing, not only, bringing down inflammation. So it balances the Th1, Th2. It has a unique effect to help with raising your own endorphins. Endorphins promote the cascade to help heal the body. So it has 2 things: lower, the inflammatory autoimmune part of the immune system, while it's increasing the part of the immune system that stimulates healing. So when we use this term inflammation, or when we're talking about inflammation or immune system balancing, there's good parts to the immune system that I feel sometimes people just forget about. So when we are using a medication like naltrexone, for example, I always try to tell people that the immune system that you want to be robust is what protects the cell itself. And the immune system that we want to help lower is outside the cell, where you have a bunch of garbage and trash and toxins and things that are, it's almost like that emergency response of, oh my gosh, the world's, burning down around us, but really what's going on inside that cell. And that's where I come in and help using naltrexone to balance that. It's a Th1, Th2 type of balance.
And I'm sorry, did you say that was more of a long-term thing or a short? Do you just use it like short term?
It depends on the situation. So I always present, patients, because they ask me that all the time. And I sometimes will tell them, like, look, let's get you out of this acute situation, or let's get you feeling good first. And then we can have that conversation, because it's kind of like thyroid or hormone balancing as well. If your body has something that's going on, let's take thyroid, for example. If you are really, really toxic, your thyroid's just not operating at like a full potential, your body is just not going to make it. So in order to get that mitochondria going, well, you're just going to have to replace it at some point. Some people can bounce back, some people don't. We don't know until we get the inflammation down and get your body start generating on its own. There are times where patients can get off medications like naltrexone. There are times where people will try to get off of it, and within 3 or 4 days, they have a full return of symptoms. And I'm like, nope. And they'll even say, this is something I'm willing to take the rest of my life because of how pinnacle it has been in their health to now pull them out of the vicious cycle they were in and then set them on a healing pathway.
And sometimes just getting a patient that small amount of momentum is really just has such a large effect on their like mental state and their ability to believe like, okay, I can actually I can get better now. I feel like
Right.
that's a really big part of it.
Do the deeper
Absolutely.
work,
It is.
which takes a bit longer. Well, I would love to jump a little bit more into the neurologic conditions you see, Dr. Werner,
Sure.
and how that links in with toxic load. Because oftentimes, and you just mentioned thyroid, we talk so much about endocrine disruptors. So
Right.
the hormonal impact, but we don't talk as much about the impact on the brain and the nervous system as a whole. So I'm curious to start off with what kind of clinical presentations or patterns or history do you start to
Right.
see in the clinic when you suspect high toxic loads, such as TBIs, Lyme. You mentioned Babesia, so that's a co-infection of Lyme, MCAS, POTS. I mean, there's so much, and you mentioned Parkinson's, but maybe subtler presentations.
Right.
I'd love to get into that.
So actually, there's a couple of patients where there was a direct thing that happened in their life that set them on this path. And it was more of an environmentally, actually, I just came back from a peptide conference where the guy presenting, the physician, registered pharmacist presenting, he specifically, I asked him about a Parkinson patient that I'm working with. And he said that Parkinson's is about 6% genetic, 94% environmental. And that's exactly what happened with this patient. His gut was so years, we're talking like 30 years on a proton pump inhibitor, which means there's a cascade of events that happen. And he was still having his acid reflux and digestive issues, which then what happens is now we have scarring from the constant irritation. So PPIs specifically turn off your ability to make the acid that's needed in order to digest your protein, and then when we are now not having the correct amount of hydrochloric acid to break down the protein, as that bolus of food is passing into the small intestines, now you're not doing a reflex, the proper reflex from your gallbladder to be able to spill out all of its contents, which is considered a like laundry detergent for your small intestines. And then a majority of the bile salts that go through do get reabsorbed. So you can actually have that detergent again for the next time you eat. Well, when you turn off that process over time, not only are you completely degrading the mucosal barrier, so that very, very extremely one cell lining of your intestines, but that inflammation that is now starting gets into the systemic blood system. And now you're starting to cause a lot of those autoimmune reactions. And what's interesting is that there are studies coming out showing the correlation between what you eat and how it's triggering these systemic autoimmune reactions. So with this Parkinson's patient, history, years, decades on this PPI, he ended up getting a surgery, which then after the surgery, within weeks, his tremors started.
Mm-hmm.
And it was like, wait a second, it was the trigger that kind of sent him over the edge. And so now I'm doing all this research and working with the patient. Like, we got to heal the gut. We got to heal the gut. We got to heal the gut, because that gut brain connection is extremely strong. If you have a break in the defensive mechanism, which is the mucosal barrier, so that good mucus lining in your gut, once you break that barrier, there's now a direct line of assault into the rest of your body, especially your central nervous system. I have uncovered a couple of studies showing that when you are dealing with a lot of that, they have shown the direct cause and the cascading effects of the type of autoimmune and the testing you can do for a Parkinson's patient. So that's just one example how I saw the cause literally trigger, and then now we're dealing with this, this neurodegenerative condition that we're trying to, I say reverse engineer. I love reverse engineer. Just come in with your diagnosis and I'll just work backwards. But we're working on getting him healed, and we are really hitting it hard with his gut, because that gut, you're only as healthy as your gut. and really it does start at birth. So with the rise of these different toxins coming into the body, well, talk to the mom. What are you eating when you're pregnant? These things, a lot of these things do cross the placental barrier. But then after the baby's born, are you breastfeeding or are you bottle feeding? Breastfeeding sets up exactly what that child needs in order to protect its first line defense through their gastrointestinal system. The moment that child, if they're exclusively breastfed, the moment they have water, juice, let's say they're now switching over to formula, those are toxins. Those are not designed to necessarily be the best thing for the child, but they will strip all of the good bacteria that was introduced to that child. And now you are at, boom, gut inflammation. And now starts the degrading of the mucosal barrier and the lining of this child. I mean, we're talking 5 months. And now, they introduce foods too early. I now hear people saying, oh, 4 months, let's give the child whatever. And I'm like, what are you doing? You don't need to introduce anything until they're at least 12 months. Like, let's really start looking at like now we're talking about autoimmunity or the hypersensitivities for food. Now you have a child who's bottle fed, losing all of the good, healthy bacteria, disrupting that microbiome. I know that's a hot topic, degrading, causing increased intestinal permeability or leaky gut. Let's, kind of the fun term that's out there. And this child is just now getting introduced to things, large proteins that they're not supposed to be handling anyway. And it's getting into their systemically into their cardiovascular system, and boom, immune system stimulating over and over and over. And now the body is freaking out saying, oh my gosh, we are under attack. That's that emergency response. The world's burning down around the house. That's not a good immune system to be developing in this little tiny child that's just trying to survive. And on top of that, now we're feeding them foods that we know are sprayed with pesticides or herbicides. There's a couple of big, ones that we use here in the United States that have been outlawed around the world. And one of them is called atrazine. I talk about this with my patients all the time, and it is in your testing. And I love that because atrazine is a strong aromatizer. So that means it takes testosterone and turns it into estrogen, but not necessarily the good protective quality of estradiol. We're talking the stuff that's not going to be good for your body. And what happens is when that conversion, does it in a small child, because it's sprayed heavily on corn and sugarcane in the United States. So let's first take a step back and say, well, what food products have a lot of corn and a lot of sugarcane? High fructose corn syrup, anything that has sugarcane in it.
Cereals is what I think about.
Right. Cereals, eat pre-packaged foods, TV dinners. And then there's the other, well, I buy organic. Well, guess what? It used to be that organic meant like the USDA organic certification said that, okay, this product is organic. No, well, they've changed it. Well, if 75% is organic, we can consider it organic, but you can still use 25% of the other stuff that makes it not organic,
It's crazy.
So, and that's the thing, is that atrazine has been studied for decades. We're talking decades on animals, unfortunately, but how it actually, because of how strong of an estrogen receptor or estrogen disrupting, hormone disruption, endocrine disruptors, whatever the term that they use out there now, it has shown to overdevelop the sex organs in a male frog. And now that male frog actually is trying to mate with other male frogs, and they have overdevelopment of their female sex organs. And now the genetic male is acting like a female. Like, I'm just going to put that on the table because that's a real issue. And we're the only country in the world that's still using atrazine. And that's a problem. We have infertility on the rise for males. We have breast cancer on the rise for males, and younger and younger. I have males walking in at 30. Their testosterone is of a 92-year-old. And I am like, well, how's that working for you? And they're like, it's not, if you get what I'm saying. And it's sad because within the United States, we know that this has a direct problem and a direct correlation causing all these cancers, causing these fertility issues, but no one's talking about it. Except for people like us who were thinking outside the box. Now, when it comes to the neurodegenerative piece of it, our hormones are so important to heal, protect, and keep our brain sharp. And it has been proven that estradiol, again, and I want to be very specific on the type of estrogen that I'm talking about. Estradiol, testosterone, progesterone, and free T3, so thyroid, your active thyroid hormone, are very protective of neuro pathways and helping to rebuild and detoxify and actually reform. You can regenerate your central nervous system, but you got to get rid of the inflammation first. So my diet has to change in everyone.
The toxins are really fueling that progression. Yeah. Okay, I have to throw out this term because I read it before, Dr. Werner. Depuration or depuration. Am I pronouncing that correctly?
Depuration.
Depuration. How is this different from detoxification?
So detox is something that you can just do safely at home where you're just like dry skin brushing, or movement. I mean, let's just get people getting up and just moving their body.
Yeah, sweat a
And
little
then-
bit.
Right.
Please.
Sweaty. And if you don't sweat, then you need to come see me because that can be an indicator of something going on in your autonomic nervous system. So
Sure.
so just those natural, normal things that we're supposed to do every day. So walking and sweating and being outside and getting sunlight and all of those things promote a good detox pathway. So depuration is a process of where I, as a practitioner, am now going to really go in and give you it could be a chelator, it could be a supplement, it could be something that's really now going to be actively going in and pulling stuff out of your bones, pulling stuff out of your central nervous system, your tissue that can cause further problems. And you have to be careful with that because if a person starts to pull these toxins out too quickly and their kidneys are not able to handle the load, or they're not taking the correct binders to make sure that as it's dumping into your GI to get it eliminated out of the body, you can hurt and you can make people feel lots like more sick and they feel like they got hit by a Mack truck. That's usually what my patients tell me.
Actually, Dr. Werner, I have a very personal experience with that recently. I was just like dumping toxins. I felt awful. Like,
Oh yeah.
I didn't really believe people when they said, different symptoms they can experience when they're going through a crazy detox. I'm like, it is real. Let me tell you.
It is. And that's probably the hardest part for people to understand is the neuro emotional, the emotional and response that you get from that. Whenever I do any types of really heavy liver detoxes, I get angry. And if we, in Oriental medicine, so in acupuncture, that's part of our clinical training, they talk about how when you have a very stagnant liver or a liver that is overwhelmed with the amount of toxins that are in there and having to go through these different phases of detoxification, you can get angry. Like you can have depression, anxiety, you can have a lot of these things that are directly in relationship with what is going on in the liver. So that's what is so unique again about naturopathic medicine is that we're taught to look at these, how everything is in direct correlation. But yes, that is feeling awful is a huge part of a good process of detoxification. Nothing that's going to get you better. Let me rephrase this. A lot of the things that I do in the office, you will get worse before you get better. I have a sign that hangs on my wall behind me and says, I'm not telling you it's going to be easy. I'm telling you it's going to be worth it. And it's true because anything that I know in my different experiences in life, anything that you have to work for, there's a greater sense of accomplishment and betterment.
Generally, nothing worth it is easy.
Right.
And we learn that in naturopathic medical school is this healing backward.
Right.
Which is really
Exactly
interesting.
right.
And I think a lot of practitioners don't recognize that or they don't take the time to educate their patients on that. So that's huge.
It's
Just
true.
telling them up front.
Right. And part of that is also the mentality in society where, okay, so I have a headache. I'm going to take this pill and it's going to make it go away. So they're trained from a very, 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 very young age that, oh, okay, well, you're sick. Let's go to the doctor. The doctor's going to make you feel better. Well, what we're seeing over the last 40 years is that's not necessarily the case because in overprescribing antibiotics or overprescribing opioids, overprescribing a, antidepressant, there's a lot of backpedaling that's happening. And we see it in medicine. Oh, you know something? Opioid epidemic, we know about that. Antibiotics and the drug resistance, we know about that. Now we need to really hone in on what are these toxins now in the environment that are causing XYZ in the direct correlation, like atrazine, for example, or parabens. Parabens is another huge one that we know have been studied around the world and outlawed in a lot of places around the world because there's a direct stimulation and a direct cause in breast cancer. Well, what do women put on their face every morning? Makeup. What is makeup full of? Parabens.
Yeah.
I mean, if it looks like a duck and quacks like a duck, right? That's how simple how I explain things to my patient. I'm like, look, I'm not going to ever say you caused this, unless they, I don't know, they just don't listen to me. But I never like get people, or I just get them thinking and educating and start changing their environment that they live in. and make sure that they understand, okay, I need to do this because of this. And yes, it's more expensive, but healthcare is way more expensive. And that's something that if we want to change healthcare, you have to educate the person, because people, like when you're sitting here, they're very, very smart. It's when people get into these huge mentalities of, well, everyone else is doing it. No, individualized medicine. Let's bring it back down.
I love all the insight. I mean, continuing on the topic of toxins, I do want to kind of deep dive a little bit into mitochondrial health.
Oh,
I've heard
man.
the term, but not an expert. And I want you to go through it. Like, I want you to explain the link between specific toxins and mitochondrial dysfunction. Is that more of a downstream effect? Is it caused by toxins? Is it
Right.
which came first? I know that's linked to like almost like a marker of like predicting disease
Right.
future in life. So I really want you to just, take what you want with that. I want to get your opinion.
Right. So first, let's talk about the types of toxins that are out there. There are man-made ones, and that's where the Industrial Revolution has really had a huge upswing in the type of unnatural fake chemicals that have been introduced to environment worldwide. And this is every single country on the face of the planet is doing this. And they're just dumping these things into the atmosphere. They're dumping these things into our water, or we're putting into products that, we're sitting here and everything's off-gassing. So that's, the man-made chemicals. Then we have natural toxins. So, 10,000 years ago, when aspergillus was growing in someone's little hut, did it affect them the same way that it does now? I'm going to go ahead and say no. And the reason why is those man-made chemicals has a direct link in causing so much inflammation in our body. Now we're dealing with high inflammation, which is a part of the immune system. So when the cell comes in, or let's say a microbe comes in, or let's just take the common cold or something. If a person has a total body burden of a lot of these man-made chemicals, you take something that has, let's say, a virus that has existed for hundreds of thousands of years or whatever. Now suddenly the person can't get better. It's not the virus. It's what is going on inside that body that's causing an increased amount of inflammation. And what the body's trying to do is simply just protect itself. So man-made chemical comes in, it gets into the cell, and what happens is now the body's like, wait a second, we got to clear or fix that, get rid of that toxin. So there's a cascade of events that happens to power down the cell a little bit so it can try to get rid of the irritant. Well, if it can't be effective in trying to get rid of the metal, the man-made chemical, the fake food, the whatever the fake non-organic, chemical that comes in, that cell now becomes compromised, and where the cell says, all right, we have lots of inflammation. If we continue to power at full speed, now we are potentially going to have our DNA, which, is inside the nucleus, come out and then be affected and change, which can change the replication process. So now we're looking at a cell that could potentially turn into cancer. So innately, the body's going to say, well, we don't want that. We're under attack. There's something wrong with this cell. Let's power down. So the mitochondria starts to slow down. Then there's a cascade of effects that happen where, well, if the irritant is still there, now the cell is going to start forming a harder exterior to try to protect itself. We're seeing that more and more. Fibromyalgia, chronic fatigue syndrome. So people always think of atherosclerosis. That's a very easy one because people out there know what that is. If you constantly have an irritant inside of the cardiovascular system, your arteries are going to lay down scar tissue. It's because it's trying to protect from whatever is in the blood that's irritating it. That is the body protecting itself. So back to that single cell, we know that now there is protein-bound calcium that will literally line the layer of the cell because that cell just can't fix and repair itself. It constantly has these irritants, man-made chemicals. So instead of, just killing the cell is just laying down a bunch of calcified scar tissue type of material to protect itself. So what I do and what I look at is, all right, well, one, we got to correct the diet. You got to stop putting toxins into this overflowing bucket. we got to stop that. So then you put out the issue with the gut. So you clean up the gut. But then when you start detoxifying someone, you have to have good elimination to be able to get these things out. Once a person goes through a detox, then what I do is say, all right, now let's start getting you back to where you can fix and repair yourself. So when I talk about mitochondrial function, I do put people on various products that directly go in to help lower that inflammation. And then I give them a huge amount of nutrients that are needed to go in and try to start fixing and repairing. Imagine if you had a job site in construction where all the materials are there, but there's no workers to build. Or if you have an abundance of workers, there's just no materials to build. That is the conundrum that we're in when we're constantly under an inflammatory state. So, people go, they drink their Starbucks, they eat their McDonald's, they're always on the go, just sitting in front of the computer, eating their lunch while they're answering emails. You're not digesting your food. That's the wrong tone. So we have that parasympathetic, sympathetic. That's that wrong tone that you're not even breaking down your nutrients and getting them into your body. So it's like mitochondrial function is so incredibly, it's a big, we could spend an hour just talking about that whole thing, but you got to remove these man-made toxins in order to now bring the inflammation down, to get the mitochondria back online, to power up the cell. Then the construction workers can go back to work.
Well, honestly, I love the way you explained that. That actually really, it made it really clear to me. Right. So it kind of sounds like there's not that there's no point, but you can't really flood somebody with a whole bunch of nutrients right off the bat, because it's almost like they won't even be able to utilize them in the same way. It's really like starting with detox. Right. I meant to detox, we got to proper elimination. And it's like whole process,
And it is. And the other side of that, when we're talking about detoxification, so part of in naturopathic medicine, we talk about biotherapeutic drainage. And what that is supporting the major organs of detoxification, which is your liver, gallbladder. That's kind of one little complex. We have your GI system. We have your skin, largest organ in the body. We have your lungs. You can breathe out toxins, which is really cool. And then we also have your kidneys. Now, what's cool is that a woman has a bonus. The menstrual cycle is so incredibly detoxifying, especially for blood. And when I have women come in, they're like, oh yeah, I'm doing the Depo shot, or, oh yeah, I don't have this and that. I'm like, oh, you're causing so much pelvic stagnation. And then all these man-made chemicals come in that are super estrogenic, promoting the wrong estrogens. And now we have fibroids and endometriosis and infertility and PCOS from, insulin resistance. And oh man, that's a whole nother one we can talk about. So yeah, we got to open up the modes to get rid of these toxins. So again, patient education, you start this detox process, your skin's probably not going to look fun. That's a great way to push things out, right? If you can't sweat or you don't like sweating, well, guess what? You're going to sweat with me. That's just what I do with people. And it's interesting because even in my own life, I last year went carnivore. I'm not 100%, but I went carnivore. It was the only thing that actually healed me. And whenever I have there are times where I'm like, oh, it's someone's birthday, I'll have a birthday cake. I'll go through about 2 to 3 day detox of that sugar and I can smell it on me. My husband's like, I can't smell it, but I can, because we can smell ourselves, right? We live with ourselves. But that's a really good place. It's just coming out of my pores. But yeah, that's really important part of detoxification is, can you even eliminate?
What are you noticing, Dr. Werner? I have to ask because, when we detox and we can smell it, and you're talking about sugar, is it like you generally don't have a body odor and you notice it after you're consuming sugar, or is it specific to maybe one weekend it was alcohol, or you went on a trip, or maybe one weekend it was more so sugar? Is there a difference that you've noticed? Because many people aren't as in tune as it sounds like you are. So I think that's great.
Absolutely. So with sugar in my body, I literally feel like my deodorant doesn't work, and I use the non-paraben, non-metal, deodorant and stuff. Sure. So it's already really, it's more the natural stuff. Technically, if you're going through a detox process, it's not going to work. It's just, you're just going to have to understand that. But it's usually my deodorant's not working. By the end of the day, I just have that body odor and funk smelling. And anyone who's gone through a detox, you know what I'm talking about. And it's interesting because you even said alcohol. So every individual is so incredibly different. And that's what I love about medicine. It makes it harder too. When I went through my own detoxification and really, really cleaning up my diet last year, I switched from more of the sugary type of like a margarita or whatever, but I only drink beer now because let's be real, I love football. I love college football. And that's just what happens on the weekends. So when I noticed that when I switched over to beer, and this isn't myself, I don't have any of those problems. Now, it's still a very strong neurotoxin. Let me be very clear. Alcohol wreaks havoc on the brain. So I just want to make sure that people understood. That doesn't actually cause any weird smell type things. It's really when it comes to just like if I have ice cream, for example.
And the dairy and sugar.
Dairy
That
and
combo.
sugar. Oh my gosh, you're right. Because what does dairy do? Well, it's a very, very, very large protein that can cause a slow, like your lymphatic system to slow down. And then most people, they usually get like, you can hear it in their voice. They get mucusy. Yeah, that happens to me too, which can also attest for why I smell kind of funky.
I do have a question. You mentioned you feel best on carnivore, or
Yep.
you went full carnivore last year. Do you recommend that to all your patients, some of your patients?
It depends on who's sitting in front of me. So I'm glad you brought that up because I actually had notes on here, and I'm not going to say the names just, because I don't want to hound on that. But there's a recent documentary that came out that it's the twin study. I think it's awesome. Like the idea behind it, I loved it. What I didn't appreciate about it is not all meat is created equal. When it comes to carnivorism, and I want to be very clear with people, carnivore is when you're eating or consuming an animal that is also consuming their own natural diet. A cow that's fed in a corn-fed lot is not natural. That is very, very pro-inflammatory. We're talking about the sheer chemistry of the meat is different with a corn-fed cattle because corn, if you're a mammal, by the way, and you want to get fat really fast, eat corn every day. Like seriously. And it's sprayed with atrazine. So not only are you going to get fat, but now you're going to have the wrong estrogens, right? So anyhow, that's what they're giving to our cattle. And that cattle, that's why people are like, oh, the marbleization, the fat in the meat is so good. No, the marbleization is insulin resistant in the cattle. It's causing horrible, horrible problems. And that's what I'm against. Now, my grass-fed cattle is not the same of what that documentary was. They're trying to rope in what you're eating from a fast food restaurant with the French fries, the Coke, the bun, the American wheat, all those things. And they were saying that's the same thing as my grass-fed cattle. That is an absolute lie. It's not the same. So when I have my patients go carnivore, they get a depth of knowledge and information on the facts about the difference between a farm-raised and wild-caught, a cattle lot, that has corn versus grass-fed in beautiful open, things. I used to run a meat co-op when I was in Florida, and I met this amazing cattle rancher who was on Joe Rogan talking about why he decided to go grass-fed. And I love what he said. He used to supply the grass-fed for Whole Foods, but Whole Foods is not what it used to be 20 years ago. So it's gone more corporate, and we'll leave it at that. But grass-fed, part of the reason why I met this rancher is because that's when I started learning about in the mid 2000s, like 2006, about the differences in the meat. And when I met him, he confirmed everything that I knew to be true and that I learned and stuff. And it's great because now there are so many people out there that are understanding that, look, cows are designed to eat grass. They have 4 stomachs. That's why they can consume the grass. That's what they're created to do. Let's not damn the meat based off of the profit margins that are needed for certain industries. And that's why with that, when we're talking about these toxins, the animal that you're consuming, and this is again going into that carnivore thing, if that animal is consuming a lot of toxins, well, these toxins love fat. So if you're eating a very fatty animal, guess what? Not only are you getting the wrong ratios of fat in your diet, but now you're consuming all these man-made chemicals on top of that. So just get rid of everything, and keep your digestion very, very simple. I went carnivore because my body was hurting all the time. I had PCOS. I already knew that I had to change my sugar and stuff because the COVID years were very, very harsh. And when you were working 12-hour days, 4 days a week in order to keep people out of the hospital, you do the best you can, right? But that stress is what started breaking down my body. So I decided in 2022, all right, that's it. I'm losing these 30 pounds I have to lose. I did that. And then the next year, I'm like, why do I still have pain? I went from 175 down to 147 pounds and I still had pain. So that's when I went carnivore and just really said, all right, that's it. Grass-fed meat, the pasture-raised eggs, fish here and there that's wild caught, and then, whatever, the highest quality. All my pain went away and my PCOS corrected itself. And now I'm back to detoxing in that regard. So it's important for people to understand. And I healed my gut. That was the other side of it. When you stop exhausting the 15 different foods and type of things you're putting in your gut's like, whoa, let's just keep it simple, stupid. That's kind of way I keep, teach people. But yeah, that's how carnivore literally changed. And I have patients who are doing that now who are like, I have no pain. I'm losing all this weight. I'm thinking clearly. I have no gastrointestinal issues anymore. What can it be that and I'm like, well, it's just the man-made chemicals. All of these vegetables, they're sprayed with something, even if you're buying organic. And then even if you're buying organic, well, how organic is it based on the new laws that are put into place? Anyhow, sorry. So that's my little carnivore thing.
I'm so glad that you asked, Melissa. And I think this opens up a lot more, one of which I think the audience would love to know, because I don't know the breakdown. So my first thought is, would I have trouble in terms of constipation? So what's the fiber source if carnivore is done right, if it's done from a grass-fed, pasture-raised eggs, etc.? How are you getting fiber?
So I don't need it. I went through 6 months, and I always tell people as you are switching, and I always have people do a transition slowly, because your gut biome has to now change and adapt to what you're feeding it. When you are starting to make this transition, I had a dependency a lot on, enzymes, just to make sure that I'm able to now reestablish the amount of hydrochloric acid that's needed in order to consume all this. So it took me about 2 months, taking the enzymes, taking digestive enzymes, probiotics, because anyone who does, whether you're doing a juice fast, a water fast, let's say you just want to give up sugar, or something, when you give the gut rest, you will actually improve the microbiome just by letting it rest. This is why a lot of people like the intermittent fasting, because the cells that turn over so quickly, now it's like, oh, we don't have this onslaught of 5, of American wheat with a, genetically modified tomato with a lettuce on top of really crappy, meat that doesn't actually have a lot of good benefits to it. So when you're removing what's causing the fire, the gut starts to settle down. And then after about 2 months, the digestion process starts to work itself out. And I mean, there's a couple teas that I would just drink, very, very gentle. If I was constipated, I'd drink this tea, and the next morning, gentle clearance. I mean, and then of course, it's also very patient specific, right? I have people do things, castor oil packs, I have an internal salt cleanse that I have people do. That's the other thing, is a lot of people are actually salt deficient. And I eat a lot of salt. And my cardiovascular markers, I have no inflammation in my cardiovascular system. And I just ran my markers with Vibrant recently. And that's your cardiovascular panel is amazing, because I have patients when they decide to go carnivore and they're going through this whole journey. All right, we're going to get before and we're going to get after, and you'll see those inflammation markers drop. Now, my cholesterol is pushing 300. It's because I had a cheeseburger the night before or whatever, because I still have dairy with my burgers, but I didn't have a bun. I don't put anything else. Onions really are the only vegetable I eat, because I love the taste of onions.
Oh, that's a good pick.
So,
yes.
But I love your cardiovascular marker. It's cheap, it's very precise, and it shows all of that neuroinflammation. That really, it's a good tool to help with bringing cardiologists into the world of, wait a second, maybe cholesterol in and of itself is not the problem.
Of course. Yeah, we have to expand on that.
Right.
Selfishly, just real quick, I know we kind of went down, a whole deep dive on this, but I got to know what brands, because I know you said not all grass fed is created equal. I know not all grass fed means grass finished,
Right.
aged grass fed, but and like thoughts on like what like wild meats. Are you ordering from certain farms? There's some I order from, so I want to
Yep.
know where you got it.
So I love Butcher Box. I promote, I don't, I'm not getting paid by them, but I remember I started with them, gosh, like 6 years ago before they got huge. And I love that. I love that they really have a passion, one, to make it affordable to bring grass fed. And New Zealand does have some of the best rules and regulation when it comes to grass fed, grass finished animals and how they even treat the animals. So they do get a lot of stuff from New Zealand, but they do really support the small town farmer who is working diligently to return to a process of letting the land rest, making sure that you understand that, yes, we have to move the cattle around so the grass can now grow and be replenished. And then there's also the process of when they process the animal, the leftovers are then used to fertilize the land again. So when there was an awesome documentary that I watched that they went into that whole entire process, life cycles, like you have to have the death and decaying of an animal to help replenish the minerals of the land. And that what was great about the farmer that I met, years and years and years ago, when he learned that concept, they did everything in-house. They processed all the animals in-house. They had the perfect way to be able to, the leftovers to now take and turn it into fertilizer. So we don't have big vats of blood, but really that's why I support that company. I love them. Like they got their system worked out and they're really trying to help, provide for families, the smaller farmer. The other company I love is for my eggs is the Vital Farms. I post for them all the time. They actually donated to my Christmas party this last year, which is awesome. When you're opening up your egg and that yolk looks like it's orange, you got a good product. If it looks like it's yellow, nope, not so good.
It's so clear to see. I tell patients and providers that all the time.
Yep, it's true.
It's striking when you see the bright orange and deep. It's so beautiful and it's so obvious.
It is. Well, and another thing that happens that's amazing, when people start to detox and when people start to get rid of sugar, so sugar blunts your taste buds. Sugar also causes a lot of inflammation. So get rid of sugar and you're much better off. But when your taste buds start to redevelop and reform, you can taste the difference between grass-fed and not grass-fed. Actually, I felt awful. Whenever we have reps that come into the office, they're like, "Oh, where do you want to go?" We're like, "Oh, let's do a local, steakhouse. This way Dr. Werner can get her ribeye and then the rest of us." I literally was like eating it and I'm like, "Oh, I can taste it. I don't like it. I can taste the chemicals. I can taste how the flavor of the actual meat it's actually not there. It's weird." No, it's not weird. It's science because your taste buds change. Mm-hmm. So when you go through a detox, things might not taste good, but your taste buds do get restored.
I've noticed even like the smell of conventional raised beef. I can't stomach it the same way as I could as a child.
Right.
So I actually relate to that. You can just like see it in the color and then, cooks and everything. So
it is.
I totally get that. But Dr. Werner, I could literally go, we could talk for hours on this. Like you just have such an abundance of knowledge and such a passion for this. I love this conversation. Yeah. But before we wrap up here, I do want to ask this closing question of what does it mean to you to live a vibrant life?
Oof.
It's a big one.
Oh my God. What does it mean to you? What does it mean to me to live a vibrant life? I'm a big Christian, and I truly believe that when everyone is placed on this earth and you're infused with your soul, we have a purpose. And when you are living out your purpose, you never have a day that you work and my life's not perfect, don't get me wrong, but you love your job and that passion you wake up to every single day. And when I really started on this journey to naturopathic medicine, I found my passion and I found what God created me for. And it's really to establish knowledge in people so they can take control and start living out their purpose. So to me, it's my vibrant life is waking up every day, understanding that I fixed and healed myself. How can I how can I educate someone to be able to do this and get control of their own health?
And it's a process and a journey, as you've alluded to, Dr. Werner, and you're
It
so
is.
relatable in that way. And I so admire that about you, where you say
Thank you.
you're a person who has your pleasures, and you go back to what you know and you abide by it, and it's something that we always have to go back to and think
Right.
about. Okay, well, like, it's not perfect, as you said, and these toxins aren't going away, but what can we
Right.
do ongoing? I think that's a very important message. So thank you for
Yep.
that.
Your energy and your health is like contagious. Like I could feel it through here, and I'm sure that our listeners can feel it too. But thank you so much for sharing your expertise with us just today, and just leaving myself and Dr. Emmy and all of our listeners today with so many tangible tips and some really unique perspectives. I love that we talked about carnivore and just like your take on toxins, mitochondrial health today. But before we sign off here, where can our listeners find you if they want to learn more about you, your practice, philosophy?
Sure. Yeah. I'm in Mesa, Arizona. I'm in a beautiful building that here in the desert, we don't have a lot of like waterfront property, but I happen to be on a lake. So
Nice.
our vibe is very laid back. So, on my website, it's synergynmd.com. And my goal is I want people to walk in and understand that you don't have to get better and fix tomorrow, but I promise you that I'm always going to teach you how to keep moving forward. It's actually tattooed on my left leg. When I did the Ironman back in 2004, that was my philosophy. Just keep moving forward. And that's how we have to live every day.
And you have a podcast that's coming out? Where is
I
that?
do. We're revamping it. It's actually called Synergy Soapbox.
Well, we'll be sure to link all your information in the show notes so that our listeners can find you. And thank you again for being here today. And thank you to our listeners for tuning in tonight. And until next week, I'm wishing us all and you all vibrant health and wellness.
Yes, thank you.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness Podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guests and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.